Hi, my name is Lauren Masi. I'm a doctor of physical therapy and a board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about why physical therapy is effective relief for knee pain. So in physical therapy, obviously our main goal is to approach, pain and dysfunction through conservative care. We want to get you back to doing the things that you want to do as quickly and painlessly as possible. In physical therapy, we're going to be watching how you move. So when it comes to knee pain, that can include things like watching how you get in and out of a chair, how you squat, how you walk, how you jog, and seeing what that means and how that biomechanics of the joint could be affected that could be contributing to your pain. That's assuming that there isn't some kind of traumatic injury, right? We know a lot of people who play sports and might have torn their ACL or torn their meniscus in higher level activities or even from falling. But in terms of day-to-day, we have a lot of people who have insidious onset knee pain, meaning they don't know where it came from, why it started, and oftentimes that has to do with the alignment of our joints. So we're going to be looking at your posture all the way down to your toes, how your feet hit the ground, the footwear that you wear, the positioning of your hips, knees, and back as you do certain bending and squatting activities, and making sure that we are making everything optimal to try to prevent any uneven wear and tear on the structures. So there's many structures in the knee that can cause pain. Some people, as I mentioned earlier, might have torn ligaments in their knee. So their ACL, anterior cruciate ligament, PCL, posterior cruciate ligament. There are these X-shaped ligaments kind of deep in the middle of our joints. We also have the ligaments, the MCL and LCL, on the sides of our knee. So ligaments are structures that connect bone to bone. They're prime stabilizers of our knee, but sometimes we can get sprains of these ligaments. Just like spraining your ankle, you overstretch those ligaments, and now you might have more play side to side, which then can unevenly wear the joint surfaces. That can lead to pain, inflammation, eventually arthritis, and eventually a knee replacement. So we want to try to catch everything early and prevent that subsequent lead up to those big surgeries. Obviously things that we look at is we want to look at someone's strength and flexibility balance. So we have a lot of muscles that cross two joints, that cross the knee and the hip, for example. So your quadricep muscles down the front of your thigh, your hamstring muscles down the back of your thigh. And I bet some of you didn't even know that you have a calf muscle that crosses the knee and the ankle. So when you come into physical therapy, we're looking to make sure that there's good balance between the strength and flexibility of all of these muscles so that we can help with that alignment. Also, a main component of our programs for the knee actually focus a lot more on strengthening the hip. Some of our big hip muscles are the ones that control the alignment of our thighs falling in or out, which can affect the tracking of the kneecap in the groove. Some of you may have heard of patellofemoral pain syndrome. So the patella is your kneecap. The femur is your thigh bone. So if that kneecap isn't tracking straight as your knee bends and straightens, that can cause some rubbing and eventually wear down some of that cartilage and maybe even arthritis. So we want to make sure that we can try to avoid surgery whenever possible. One of our mottos here is we want to get all of our patients back to normal without unnecessary medications, injections, and surgeries. So we want you to start with a good evaluation of all of these things to make sure that we can avoid surgery, avoid those surgical risks, avoid the time off work, the physical money expense of all of it, and get you back to function as soon as possible. So if you'd like to have us have a look at your knee and how you move, please give us a call and set up a complimentary consultation or evaluation. Thank you.